So we're going to go ahead and jump in. We're actually doing acid-base today, which is a very difficult topic, no matter what kind of student you are, whether you're a medical student, a nursing student, paramedic, respiratory therapist, and whatnot. And I actually learned how to master acid bases myself from a respiratory therapist back when I was still a paramedic. And I learned kind of the way to conceptualize everything, and that's exactly what I'm going to go over for you guys today, along with a couple of corny jokes, as always, just to kind of get you in and going, which are always my favorite. So definitely, we're going to go over acid-base values and understanding the basics. We're going to go over some interpretation of some acid-base imbalances, and then we're actually going to go over some compensation things, which a lot of students seem to struggle with. So I work as kind of the liaison from thousands of students and Picmonic users, and I kind of gather all of that feedback and compile it to make sure that we can offer the best information. So inside of this webinar today, you're going to see lots and lots of graphics. And if you see those graphics inside of here, like here over on the side with this acid-base, how to interpret acid-base disorders, these are all graphics that come from our Picmonic product, which all correlate with a particular character inside of our system. So we're going to go ahead and get started. We're going to go kind of slow and go over everything and make sure that you're really going to cover everything. So what do you need to do, of course, to get an acid base? Well, we have to have arterial blood gas sample, an ABG, right? You hear about getting an ABG, and what is one of the things that we have to get an ABG is we actually have to get arterial blood. And, with that arterial blood, what is the name of that test? Oh, I forgot to preface with this, is I actually like to interact with the students a lot, and we have lots and lots and lots of interaction, to interact with you guys one-on-one kind of basis throughout these webinars. But what is the name of the test that you actually do when you draw an ABG from a wrist? What is the name of that test? Does anybody know right off the top of the head? Anybody? Kind of just, I usually don't wait too long, right? So yes, Erica, that is the Allen test. So you actually, hold on both sides of the wrist. Yes, Carrie, Stephanie, yes, Allen test. We do this Allen test to make sure that we have collateral circulation before we draw an arterial blood sample. And why do we do that? Well, very high yield fact, or just like with anything. We want to do pressure on both of the radial and ulnar artery. We want to push down and make sure that the collateral circulation is there, because if what would happen doing an ABG or this needle lab draw into an artery, let's say we mess up, and sometimes as clinicians we do mess up. I mean, that's reality. But what we do is we make sure we do this Allen test to make sure we have collateral circulation of the blood coming through both arteries to the fingers. Because if we didn't have collateral circulation and we did it, then what would happen? Well, I mean, you'd lose your hand, and that's exactly what we didn't, or the patient would lose their hand, and that's exactly what we don't want to have happen. So what we're going to go through is these ABG lab values. We're going to go over the normal lab values. We're going to go over some conceptual things of each particular one. We're going to understand the system that regulates it, and then at the end we're going to put it all together. So we're actually going to gather and compile the information to make sure we have it all together so that we can understand and actually interpret acid-base values in the best way and the easiest way possible. I'm telling you, by the time you get to the end of this, you're going to say, wow, I wished I'd really learned that way the first time. And that's the way we want you to be. And that's exactly what we do here at Picmonic. We educate you to really understand how to understand the concepts and what's going on and keep things straight. So let's look at the lab values. So we have 3 lab values that come together with any ABG. So we have CO2, carbon dioxide, right? So carbon dioxide and HCO3. And HCO3 means bicarbonate. And as you can see here on the left-hand side, I have this CO2, little CO2 molecule here on the left. Then for HCO3, we use this bicarbon. So 2 cars, bicarbonate, to kind of help you remember. And acid base, we remember, of course, is a scale of 1 to 14. So first off, you need to know the normal values. So what are the normal values? Now, first off, if you're glancing at these, don't go hating, because let me tell you what, you know that every single book and many labs have very different values. So I'm using these. They're maybe different from the book or 1 number off from what you're exactly used to learning. But carbon dioxide, 35 to 45. Now, do you need to actually remember everything that goes with the endings? Not necessarily. We're going to remember concepts at first. And bicarbonate, 22 to 26. 22 to 26. So carbon dioxide, 35 to 45. Bicarbonate, 22 to 26. And what's the normal acid-base range? What is it? That's right. That's right. 7.35 to 7.45. So let me just tell you a little secret right away. I can't remember numbers. I'm awful at numbers. Yes, I was there once. I was a student too. But let's just look at this commonality when I look at ABG values. So I know right away that 7.35, 7.45 is the same as 35 to 45, right? Yeah, it makes sense. What you need to do as a student to master things, right, Stephanie? To master things, to keep it together is make associations. That's definitely something that you've got to do and really understand. So carbon dioxide, 35 to 45, acid base, normal value, 7.35 to 7.45, and then bicarbonate, 22 to 26. So let's take a look and actually look at each individual one of them. So we know the normal lab values. You have to know those normal values hardcore. You've just got to know it, understand it, and have it. And what we're going to look at next is understanding a concept of each one. So we're going to look at each particular one and know the system that regulates them. And we're going to get to that. And then at the end, we're going to put it all together. Sandy, you say you can't read other people's comments. That's because we don't necessarily post other questions, but I can see them here to interact with you. So if you have a question or you want to answer something, go ahead and type it in. And if we can get to it right away, we definitely will. So we're going to go right into this just for the sake of time, because I really want to spend a lot of time going over exactly how to interpret these the best. You're welcome, Sandy. So pH, let's look at this. So we know the normal value is 7.35 to 7.45. Well, first off, I'm going to say, well, 1 to 14 is a normal pH, and I have to think, how do I remember that? Well, I mean, there's lots of things that go along with the pH. Let me just get my little note sheet down here so I make sure I don't mention and skip any really good high yield points for you. So I look at the pH, and it's actually backwards. pH measures the number of hydrogen ions, because the people that came up with the pH scale actually the numbers are opposite of what you'd normally think, because they use a logarithmic calculation, which means it's opposite, which is very confusing, and we're not going to go into that. And what I like best about this is just remember that alkaline is a high number, and acidic is a low number. And how are we going to remember that? Well, with Picmonic, we like to remember that acidic is an acidic lemon. And so you're going to see in all of these, if it's a low number, a very low pH, that it's an acidic property. And so you're going to see lots of lemons. And if it's a high number, you're going to see a high alkalinity, and you're going to see it means it's very basic. And well, how could I remember that? Well, this is one of my favorite times in every single webinar that I do, is I like to just key in these little extra points that just really help you out. And plus, I also like to make really corny jokes. So one of my favorite things to remember this, you're never going to forget it, is, so you're a 10 on the pH scale. Girl, you're basic. Or boy, you're basic. But if you remember that, that's going to remind you every single time. I guarantee it. I guarantee it. And that's right, Jen. Yes, you will never forget it again. Oh, yeah, hot stuff. You're a 10 on the pH scale? No, you're basic. That remembers a 10, a high number, base, base, base. Do not forget that. If you can remember one, you can remember the other, right? If you remember one, you can always remember the other one. So remember one. The other one's the other one, and that's always what you need to remember. So remember, you're a 10 on the pH scale. Oh, no, you're basic. So let's move on. So what's next? Next, we're going to go over carbon dioxide. So carbon dioxide, CO2. Carbon dioxide, we need to remember that carbon dioxide has acidic properties. Carbon dioxide itself, if you think carbon dioxide, you should think acidic. Now, why acidic? Well, first off, CO2, what you need to remember is CO2 is managed by the respiratory system. So you can see this acidic lemon here with this, these lungs, and that is a acidic lemon with lungs. And what you need to remember is that if you have an acid with the lungs, you think, CO2 is acid? This doesn't make any sense. Well, that's because when CO2 enters the respiratory system and goes into the body, as soon as it combines with water, it becomes carbonic acid. And that's why CO2 is actually acidic inside of the body. And that's just another key fact you need to remember. And if you remember this little CO2 molecule right here, you can kind of remember the CO2 molecule. See how he's got these, these stacks here for smoke? I want you to remember respiratory system. CO2 stack respiratory system. CO2 stack respiratory system. Oh, but yes, you can probably guess there's a corny joke coming up, and absolutely I got one ready for you. So you remember the acid-base one, right? With this one? Okay. Now I've modified this over the years. First, I just had to modify it for current times, so don't judge me. But you mad, bro? Maybe you should go outside and blow off some CO2. I want you to remember that. You mad, bro? Well, go outside. Go outside and blow off some CO2, okay? Don't be mad. Go blow off some CO2. And what that's going to remind you is you're going to remember that CO2 is always managed by the respiratory system. And as you breathe, you're blowing off CO2. So if I take a big deep breath, if I'm have lots of respirations and I'm blowing and I'm blowing and I'm blowing, what I'm going to know is that I'm blowing off and I'm removing CO2 from my body. That's a concept in a system that you need to understand. If you can master this, acid bases are going to come very easy to you, right? Trust me. We're going to get to the end. You're going to love this. So let's move on. So don't be mad. If you are mad, go out and blow off some CO2. Puff and blow it all out. So what's next? HCO3, or bicarbonate. So if we're looking at bicarb as we call it, bicarb is very, very basic. Well, number one, I remember respiratory and acid, and I know that bicarb has to be the opposite, right? Correct. So bicarb is very basic. So what I need to know is that bicarb is basic, and bicarb is actually managed by the renal system. And I've got this little image in here for you to really help. That bicarb is, just think of baking soda or something to the like. It's very basic. And bicarb is managed by the renal system. And if you remember that if a bicarb problem is managed by the renal system, that's a metabolic type problem. If there's something wrong with the metabolic type system, the renal system, it's going to be the kidneys. That's what you need to remember. So definitely what you need to do. So, does anybody remember what a high pH is? What's a high pH? What does that mean? Right, Todd, Josh, right. A high pH is over 7.45, and that means, girl, you're basic. You're basic, remember. So it would be logical to think if we have lots and lots and lots of base, lots of bicarb, that we're going to be thinking we're going to be thinking a basic problem, right? These are, as much as I'm sorry, ladies, girls with basic problems. And I only say that because I'm a guy, of course. And it makes it easier, right, Aline? Suzanne, Mary, right. Alkaline, alkalosis, those are basic problems. Everybody's got basic problems, right? I love to make these jokes all day long. And if you stay here the whole time, trust me, there's plenty of bad jokes coming. So these are, high pH is a basic. Remember, you're a 10 on the pH scale. Girl, you're basic. Definitely. And bicarb, B, basic. You're going to associate these. And you can remember this I like this little kidney guy from our Picmonics learning system because he's peeing out into this urinal. He's from one of our Picmonics. And you can remember that a kidney, urinal, you're going to be able to associate those together. So let's move forward. So what next is another bad joke. Sorry, friend. I'll take forever to stop being so basic. So does anybody really know what that means before I spoil the joke? So, right. So that's exactly right. So what you need to remember with the renal system, so let's think first on the respiratory system. The respiratory system is you're breathing all the time, right? And you can get mad and irritated really fast. I mean, I know I can. I'm not a hothead, but I could get excited, really quick, like a little angry dog, like my little dog Stitch. So I get excited really quick and I breathe fast. But the kidneys are very, very slow to respond, and that's a very important thing, right? Katie, Scott, yes, they take a while to compensate, to enact, to start activating. So what that means is if you have a problem, that the kidneys are slow to react, and you should remember that I like to use a general rule of 24 hours, but it's actually 6 to 12 hours on a minimum that the kidneys actually take to start activating to do any type of compensation, as we're going to get to in the end. So sorry, friend, I'll take forever to stop being so basic. And that's maybe a little stretch, but definitely one of my favorite jokes. So we went over the normal labs. We learned the concepts of each. And we know the system that regulates each one. So, I mean, that seems like not a lot to understand, but that's all we need to get started to actually interpret acid-base imbalances. Stephanie asked, how long does it actually take? And just like I said, so it takes a minimum of 6 to 12 hours for the renal system to really kick in and actually start taking over this and taking care of bicarb. Let me just back up for a sec. So the actual kidneys, the kidneys in the renal system, let me just explain this a little bit better. I don't know that I explained it. The kidneys do two things. There are two functions that actually the kidneys do with bicarbonate. Now, they don't make bicarbonate. In fact, what they do is they reabsorb bicarb, right? They reabsorb bicarb to save bicarb. They take it back out so that it doesn't get excreted out into the urine. And the other very important thing that they do is they excrete, they get rid of acids. And what's a very, very, very common acid that gets lost in the urine very quickly that we need, and it just goes away? You know, something goes wrong with your kidneys and you just pee it all out? What's one that gets imbalanced all the time? Right, Marianne, potassium. Potassium is something that's very acidic, and what happens is, you know, if there's a kidney problem, potassium builds up, or it gets excreted too much with things like diuretics. And so what the kidney's function is to get rid of acid. And a very important concept, and it's a little difficult, lots of students to understand, is that, let's say you're in renal failure. So I'm in renal failure, my kidneys are no longer working. If my kidneys aren't working, do I have a high bicarb level or a low bicarb level? What do you think? If I don't have any kidneys and my kidneys, yeah, lots of you guys are answering high, and that's not right. But Nick, Ahmed, Josh, Paula, yes, you have a low bicarb level, because what happens is you can't reabsorb the bicarb from the urine. And that's a very difficult concept to understand, because what you need to remember is that the kidneys reabsorb bicarb. They pull the bicarb back out and they keep it in. But if you don't have any kidneys, then you actually have a low bicarb level. And that's a very difficult concept to understand and kind of wrap your head around. And we're going to go over it, and you're really going to get it by the time we get through these examples. So what we're going to do now is put it all together. So let's go ahead and look at some. Let's go through the steps. So this is just a sketch here of an actual Picmonic that I helped make, and actually goes you through the steps of 1, 2, 3, how to actually interpret a Picmonic. And me personally, I'm a visual learner. For med school, I have used Picmonic to really understand the differences and to remember these common associations, aside from with my corny jokes, but also with beautiful pictures that allow you to keep things, you know, conceptual into a very methodical process. And I use images. And I use images and associations to keep things straight. And that's a very important concept to understand. So we're going to do this really 3-step process to understand acid-base values. So we're ready. We got the basics. We know what CO2 is for. What's that? Respiratory system. If I say bicarb, what do you say? Basic. Well, you could say kidneys. Right, Shannon, you could say kidneys, but you should say basic, right? Basic kidneys, right? And when you think in pH, a high pH is basic and a low pH is acidic. So we're going to go through each particular one, but we're going to go through in a very methodical, same process, and you're going to get these every single time. And at the very end, after you've understood the basics, I'm going to introduce you to the concept of compensation. And it sounds very difficult, but if you don't follow the steps, 1, 2, 3, 4, compensation is very, very, very difficult. So let's go ahead and look at some. And I'm going to run you through the process of how you should be thinking yourself, how to go through these questions and really master them. So let's look at some. And this is going to be so easy as cake by the time we're done. So first, pH. A low pH, acidosis. A high pH, alkalosis. And this is really difficult because you think acid, there's acidosis, acid. Alkalosis, basic, high pH. So there's lots of the same terms to understand. Alkalosis is a high pH, and those are just kind of things you really kind of got to group those together to make sure you get them no matter what, right? Alkalosis, high pH, basic. Got it. That's what you should be thinking. So we're going to look at the pH, then we're going to interpret the CO2. And we're going to look at the CO2 and we're going to say, is that level normal or is that level abnormal? If I know the normals, then I'm going to know whether it's not right or not. And I'm going to determine whether it's a high or a low. And what we're going to do is we're going to look at this pH and we're going to say, if the pH is going up, is the CO2 going opposite direction or the same direction? We're going to see this in just a second. And what you're going to know is if we're basically trying to determine if the CO2 is the problem or the HCO3 is the problem. And what does that actually mean? If I say CO2 is the problem, what does that mean? I'm just asking you to put it back together. What does that mean? Anybody? Right, Betty, yes. If I said CO2 is the problem, that means it's a respiratory problem. Yes, because CO2 is respiratory. Go blow off some CO2, bro, because you mad. Don't be mad. Go blow off CO2. Get out of my face. Go blow off some, right? Exactly. And that's what I want you to think. We're trying to determine if it's a respiratory problem. Then I'm going to look at the HCO3, the bicarb, and I'm going to say, is that normal or abnormal? Is it high or low? And what that's going to tell me is if it's a metabolic problem, and that's exactly right, Carla. Is it lungs versus kidney? And that means, yes, HCO3 means it's a metabolic problem if those are particularly, if I can focus in on that. And what we're going to do is, yes, a couple of you mentioned, like Rachel here mentioning Rome. And this is probably something that you learned, maybe you heard, or if you've ever Googled anything on a forum, is ROME. And I'm actually going to hit this at the very end. Rome, R-O-M-E. And what that means is respiratory disorders go in opposite directions. So if you see R, respiratory, O, opposite. Respiratories go in opposite directions. If you're not quite grasping that, we're going to see in just a second. And metabolic disorders or kidney disorders or HCO3 problems go in the same directions. R-O, respiratory opposite, M-E, metabolic equal. So now I really want to hit on that right this second because I really want you to pull that in once we put it all back together. Definitely something we want to do. So, and the last thing we're going to do, of course, is we're going to figure out if there's any kind of compensation present here for these particular disorders. And we're going to get to that very last because I don't want to throw that in and make you very confused. So, let's go ahead and look at this one. So you're always going to be basically given, you could be given a patient scenario. And we're going to get to those patient scenarios last. But let's look at the actual values. You're going to be given a pH, a CO2, and an HCO3. So a pH, carbon dioxide, and a bicarb. And what I want you to do is go through the exact same steps. So if you look here, I've got the pH right here on the left. In the middle, I've got the CO2, and the HCO3 I've got right next. And I want to run you through this exact same methodical process. I want you to think of every single time. Never skip this process, and you will not go wrong on acid-base. It doesn't matter what step of the process you get thrown into on the question, start at the beginning and run through the same steps. You're never going to fail if you follow the same recipe. You know, I love to make pies, one of my favorite things. And what I always know is that if you skip a step in making a wonderful pie, it never quite turns out the same, and that's exactly the same thing here. So, I see a couple of you are already trying to type in the answer, and that's great. I'm very excited. We're going to run through this together. So, what first I want to do is I want to look at the pH. What is the pH? Is the pH low? Is the pH high? Is the pH normal? What is a normal pH? The normal pH is 7.35 to 7.45. We remember that. And what we want to do is say, okay, is this one high or low? So let's look at it. Well, we know that this pH is low. So as soon as we say low pH, is that a basic girl or is that an acidic girl? Well, that's an acidic girl. That's low. And think acidic lemon. That's what we're going to be doing. So there's a low pH. So let's look at the CO2 here next. CO2, I know the normal is 35 to 45. What is the CO2? Is it low, normal, or high? Because it could always be normal, right? Right, Jerlini, yes. Lots and lots of people jumping in, so I'm sorry if I can't grab all of you. Yes, so that's Carmel, Kristen, yes. The CO2 is high. It's way above 35. That's absolutely right, so that's a high. Now, let's just stop right there. Stop. As soon as you see a pH that's low and a CO2 that's high, are those opposite directions or are those the same direction? Hmm, I don't know. It seems quite a puzzling question. Are they opposite direction or are they the same direction? They're opposites. And as soon as you think opposite direction, pH and CO2, you should be thinking that this is a respiratory problem. So I immediately know that this is an acidic problem, and those are opposites. So I almost every single time, and I mean this 97% of the time, respiratory acidosis. But let's go ahead and look at bicarb, just so we make sure that we're doing it correct. So what's bicarb? Is it low, normal, or high? Bicarb, 22 to 26. Well, that's a normal value. I know that. It's normal. So what is the answer to this question? I don't quite understand gay white cowboy boot means, but yes, sorry. So let's, yes, so Linda, that's a normal, normal. Jerlini, yes. So what's the problem here? It's respiratory acidosis. So what I did very quickly, immediately, I was able to start with the pH. The pH is always going to tell me whether it's acidosis or alkalosis, right? Boom, got it. You should never miss that. And even if you're doing questions, if you're answering questions, if you just get the pH, I mean, the likelihood that 50% of the answers are alkalosis versus acidosis, I mean, you've increased your guessing odds by 50%. Boom, instantly, right? Absolutely, because what I can tell you in a hint a little later is that's very, very, very rare, unless you have a very mean instructor, which they're out there. It's very rare that in real life, a compensatory mechanism actually brings the pH back into a normal range. And we're going to go over that at the very end. So we instantly know this is respiratory acidosis. So let's think about it. Respiratory acidosis. If I think respiratory acidosis, and I accidentally skipped ahead on my slide here so that I can't ask another mean question. So let's think about this. The pH is acidic. And if I know that this is a respiratory problem, and I know that what the whole purpose of the CO2 mechanism is, and I know that if you're mad, bro, you need to go out and blow off some CO2, right? Because you need to blow. If I'm breathing, I'm removing CO2 from the body. If my CO2 is really high, am I breathing a lot? No, right. You guys are absolutely right. I'm not breathing a lot. So these patients are not adequately oxygenating. So let's look at the basic concept we're doing. And I'm going to go a little faster on these once we get to going, once we get moving. A pH, it's acidic. Well, the problem here is that it was a respiratory cause. And if I know that my respirations, right, if I'm not adequately breathing, I'm breathing slow. What kind of patients aren't breathing slow? Let's say we have a drug overdose patient. Somebody got a little too many benzos, right? Way too many benzos, and they're gorked out of their head, breathing at a rate of 6 per minute. What kind of acid-base disorder are they going to be in? Well, they're not breathing very well, so they're probably going to be in a respiratory acidosis type state. And what I can tell you, so let's just think about this. No respiration, you're going to be building up CO2. I mean, this is just common sense after you understand the concepts. Right. You guys are shouting answers faster than I can even mention your names. But yes, if you're breathing at a slow rate, a slow respiration, I mean, if you held your breath, right? Think about this for a second. Everyone here can try to hold your breath. I can try to hold my breath, and you see people trying to hold their breath and try to go to war. I bet I can hold my breath longer than you. When you were 7 years old, don't lie, you tried it too. If you're saying you're not, you're lying to me. You tried to hold your breath, and when you tried to hold your breath, eventually you had to breathe, right? Well, what made you breathe? Anybody know what triggered you to absolutely finally breathe? I mean, everyone does, and I'm just going to take a little drink while we wait. Right, Betty, Rachel, Eileen, Jerlini, Michael, yes, Monique, yes, a buildup of CO2. Yes, Ahmed. So you build up CO2. If you're not breathing, you're building up CO2 in your body, and that is the actual mechanism. That's the mechanism that drives you to breathe. That's the mechanism that says, hey, take a deep breath. Take a deep breath. You're building up too much CO2. That is exactly what makes you breathe. Now, just as a little hot tip here, just for you guys who are really into it, what type of patient doesn't have that hypoxic drive? Or what type of patient doesn't drive on CO2? You guys, there's so many answers I can't even keep up. Right, a COPD patient has the improper drive, and they actually drive on whether their oxygenation is low, and that is why you can't put them on oxygen, because O2 drives that sensor that says, take a big deep breath, and that's exactly right. So let's think about like a sleep apnea patient. A sleep apnea patient, you see these patients, they're very often overweight. They're sleeping, they're at night, and they're in the middle of the night, and they don't take a big deep breath because they're overweight, and you know it's slow for them to take a deep breath, and so they're not breathing as much. But what makes them take those giant gasps of breath? What makes them wake up from sleep? The thing that makes them wake up from sleep is that they're building up these CO2 levels, and their brain says, wake up! You're drowning! You don't have enough air! And that is what, that fact, the lack of, the buildup of CO2 causes their brain to, whoa, boom, I need to wake up and take a deep breath. Yes, you guys are shouting out answers faster than I can even possibly mention your names and pay attention, because I have ADD worse than you guys could ever imagine. So let's move on to another one. So you've got this great concept, and that's what I want you to get. So this next one should be really easy. And just so you know, there are lots, everything we just mentioned, everything, signs and symptoms of respiratory acidosis, having trouble keeping it all together in a quick. This is a respiratory acidosis Picmonic, which lets you instantly recall all those signs and symptoms of respiratory acidosis right away. So let's look at the next one. So next question, excuse me, is a pH 7.61. So what do we know about the pH? Quickly. Right, high. So immediately, 7.61 pH, boom, alkalosis, done. What are we going to next? CO2. So we're going to look at this CO2. Is that normal? Is it high? Is it low? Is it a Cadillac? Well, that's CO2. That's right, guys. You guys are shouting out the answers. Paula, Rose, Joshua, Christy. Think about it. Yes. Katie, I'm seeing you. I see you lots. Rosa, yes, the CO2 is low. So instantly, boom. What should you be thinking? Wow, so those are opposite directions. I went to pH, the second step was CO2, and those are opposites. So I should stop and think, and I should say, they're definitely opposite. Let me just go ahead and check the next step, and let's look at the bicarb just to make sure I don't mess anything up, because I want to follow the same process. What is the bicarb? Is it normal? Is it high? Is it low? You guys are shouting out the answer even faster than I could possibly keep up. But that's right. Suzanne, Susan, Christy, Ernestin, Lori, yes, that is normal, a normal bicarb. And what does that mean? So let's stop and look. pH, CO2, if you go through this step every single time, do not skip these steps. pH, boom, got it. Alkalosis, acidosis, it's alkalosis, got it, I know it. CO2, next step. I look at the CO2 and I say, that's opposite. I mean, that's definitely an opposite direction. Boom. You could stop right there almost and say, wow, the problem is a respiratory problem. It's definitely what? What's the answer? Boom. Respiratory acidosis. You guys are getting this straight away. Looks like Celine, Christy, Eric, Sandy, Betty, got it. And even some of you are jumping into, like Donita there, I see what you're doing. You're jumping ahead on what I'm going to teach you next, and that's exactly what I want to cover. I want you to understand conceptually what's going on. And the whole idea, so let's, boom, we got it. Respiratory alkalosis. And this is one of my favorite Picmonic characters. And I love this character. I just have to go ahead and point him out. So this is the respirator for respiratory, elk, loser. L for love, right? This is the respiratory alkalosis character that we use in Picmonic. And what do I know with respiratory alkalosis? And if you saw the Picmonic on this is one of my favorites. Respiratory alkalosis, what's the pH? Basic, right? It's a basic pH. Poor thing. If I know the CO2, what's going on? I'm removing too much CO2 from my body. If I'm getting rid of too much CO2, what's going on? Right, I'm hyperventilating. I'm definitely, I'm freaking out. I'm breathing up 30 times a minute, 60 times a minute. What am I doing? Yes, hyperventilating. And I can tell you almost any NCLEX type question is going to give you the exact same scenario. And some of you guys are typing this in. I can't even, Stephanie, I can't even I can't even throw it in as fast, right, Michael? Yes, hyperventilating. I can't even throw this in fast enough. What happens when you breathe too fast? What kind of patients are these? They're panic attacks. I can almost tell you every single panic attack patient. If you see a patient and they have a panic attack, what happens? Boom! They start breathing way too fast. And the problem isn't that they have too much oxygen. It's that they have too little CO2. Because what drives our brain to breathe? That's a CO2 level. And if I freak out and I'm breathing too fast because I have anxiety, I'm blowing off too much CO2 because I'm mad, bro. I'm real mad. And I'm freaking out. Almost got me there. And I'm freaking out a lot. And I blow off all this CO2. And when I blow off all this CO2, I'm breathing really fast. And what happens? Well, I get all these paresthesias. And what do I get? I get this trough sign, right? And I freak out. My hands draw up. And finally, what happens? I black out. And when a patient blacks out, what happens? Well, your brain, that's your brain override if you have an anxiety attack. Your brain overrides, and usually it resets and says, hey, crazy, you need to slow down. We don't have enough CO2 to keep things going on. Slow down. You pass out. Most patients immediately fix themselves because they have definitely too much they have hyperventilation. So trousseau is when the fingers draw in. They draw in like this. And when you become too alkalotic, there's a calcium exchange, and that calcium exchange in your body because of ions causes your fingers to draw in like this. They draw in. You see patients actually kind of claw up. And it's another thing you see with a calcium disorder, right, guys? Yeah, you guys are crazy. You guys are answering my questions. You must have been on the last webinar. So let's just take a sec and let's think about this. So what do I do for a patient with respiratory alkalosis? The idea of what I want to do for them, I don't inject acid into their veins. No, that's not right. I want them to rebreathe the amount of CO2. I want to increase the CO2 level. So I need to decrease the respiratory rate, or I need to have them do what? Breathe. Now, when I was, this controversy, this changes every couple of years, so I want them to rebreathe into some cupped hands, right? Like this. Or you use a paper bag. I came from that period of time when you're not supposed to use the paper bag, and they switched to cupped hands. But yes, so cupped hands, paper bag, that allows you to rebreathe the CO2 to increase their CO2 level. You want to slow their respiratory rate. That's what you want to do. So let's look at a couple more. Go ahead and keep moving on. So now that we've understood the concept, this is our respiratory alkalosis, Picmonic. And you can see right here, instantly, boom, respiratory alkalosis, this alkaloser right here, he's got his anxiety bag. He's freaking out. He doesn't know what's going on. And inside of you, you're going to see all this paresthesias. You're going to see this sign or truce. And you're going to see lots of things, these signs and symptoms that go along because you're hyperventilating or hyperventilating, often patients. And that's one of the great things about Picmonic is to really explain a lot of this together, a lot of these particular things and information. So let's move on and go to the next one. So the next one is a pH of 7.47. 7.47. Is that pH high or low? Kind of going fast. Yeah, going a little faster. Yep, the pH is high. It's above 7.45. So what does that mean? Right, Joshua? That's alkalosis. It's a high. It's an alkalotic state. So, high, girl, you're a 10 on the pH scale. You basic alkalosis. So what about the CO2? Let's look at that next. CO2 is high. It's above 45. Now, I mean, this is different than what we ever had before. We looked at the pH, we looked at the CO2, they're both going the same direction, right? They're going the same direction. Well, let's make sure the bicarb, we should immediately think, well, I mean, we should make sure that's something's going on there before we make any assumptions. I see lots of you typing in the answer, but we got to make sure. Otherwise, if you don't follow the exact same process every time, you jump to an answer too quick, and that will tell you that, you don't want to jump to steps. So, high CO2, what's the bicarb? Bicarb high, normal, or low? Bicarb is high, right? The bicarb's high. So, immediately, boom, 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 up, up, up. And I can tell you, immediately, in a second, if I see up, 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 or down, 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 It's an alkalotic problem, and I immediately know what. Right, Kimberly, Carment, you guys, Betty, Danita, you guys are typing this in. Jasmine, uh, yes, 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 yes. Jolena, Claudia, anybody else? Shonda, oh my goodness, it just lit up. There's like 40 of you answered all at the same time. Right, that means it's a metabolic alkalosis. So, pH, high. Basic girl, right? High pH, lots of baking soda, and it's an alkalotic state. So I saw the CO2. It's going the same direction, up. And I saw the bicarb, up there. That means it's a metabolic problem. So what's going on with this patient? Well, it's a metabolic type problem. Well, metabolic means what system? Kidney problem. So I'm retaining too much what? Bicarbonate. I'm reabsorbing way too much. It's a renal type problem. So let's look at metabolic alkalosis. The pH is basic, right? Way too high. The PCA2, we know that it can be high or normal. We're going to go over normal CO2 in that in just a second. But at bicarb, if it's way too high, you're retaining too much bicarb, way too much in the system. So you're reabsorbing way too much in that proximal tubule, the nephron inside the kidney. I'm taking way too much out. And that tells me that there's definitely something going on. It's a metabolic alkalosis type problem. And I actually had a really good high yield point here for this. And I just can't remember exactly what it was right off because I got a little too excited, I won't lie. You guys are really way involved here, and it's definitely important. Right, Kaylee? We're going to get to that in a minute. So what we're going to do is we're going to go ahead and go on to the next one. So metabolic alkalosis. So we're reabsorbing way too much bicarb. Let's go ahead and look at the next one. This is our metabolic alkalosis Picmonic. To kind of tell you a metabolic alkalosis type state, what you're going to see, and you're going to see arrhythmias, this arrhythmia drum, and this is actually one of my favorite characters, this little one right here. It might be shaped in the state of California. I'm sorry if you're from California tonight, but this is our excited state character. And I just always think of like California, you know, they have all those bizarre rules. I'm sorry if you're from California, but it's like, California, excited state. They get excited about everything. They have so many rules, I don't even know. They make all the rules first. Not saying we don't follow them after that, but you can see lots of signs and symptoms in here with this alkalosis, which we're going to go over last. So let's look at this next one, 7.32, and this one's going to go a little bit faster, just so we can go through it. pH, boom. Christine, Kaylee, Ariane, Christy, Tracy, Ernestin, Kaylee, boom, boom, boom. pH, low. What do we know? Boom, acidosis. That's right. Instantly, that's what you get. Look at how we just immediately, boom, slice the answer choices in half. In a second. PaCO2, 30, high or low. Instantly, you guys are going so fast, boom, low. Instantly. Is that opposite of pH? No, it's the same direction, but let's make sure we're doing the right thing. HCO3, high, low, what is it? You guys, boom, got it, so fast, low. So I see pH, CO2, bicarb, all in the same direction. What am I thinking? Instantly, it's a metabolic type problem, and it's metabolic acidosis. You guys, I can't even, seriously, like 40, 50 of you instantly answered in like a second. I can't even shout out how quick you guys, it's faster than I can even think, but you got it, boom, metabolic acidosis. So let's look at it. It's an acidotic problem. pH went low. And here's an interesting concept. I want you to think about this. So why are we able to instantly know that a respiratory problem is opposite and a metabolic problem always goes the same direction? I want you to think about that just conceptually based on everything we just went over. Why am I able to immediately always flow you through those steps and tell you that if you go through those steps every time, you're not going to mess up? Why? Does anybody know? Well, Jolene, I mean, that's kind of cheating because of Rome, but yes, I mean, that's true. Tracy, yes, you too. I mean, because the book says so? Okay, no, because instantly, just think about this. How quickly, which system instantly reacts? Which system instantly reacts? Is it the respiratory system instantly reacts? Got it? Or is it the renal system that instantly reacts? If I have a respiratory problem, is my renal system going to be able to instantly react if I'm hyperventilating because I freaked out because of a panic attack? No, it's not going to. It's not going to. That is absolutely impossible. Right, Sahar, the respiratory system reacts. The respiratory system reacts, and what happens is, so instantly, if I think about this, if it's a respiratory type problem, do respiratory problems happen quickly or slow? They happen quickly. I freak out right now. Ah! I freak out, and I have a moment, and I have a panic attack. Oh my God, I'm freaking out. My renal system needs 6 to 12 hours to kick in, even to compensate, right? When you think about these questions that you're answering on any type of exam, and if your instructor understands the mechanisms behind it, they're not going to throw in that type of scenario. They're going to give you a hyperventilating patient, and they're going to tell you what's going on. They're hyperventilating, blowing off too much CO2, but the bicarb has to be normal because it doesn't have time to compensate, right? That is exactly right. So anytime that there's a metabolic problem, a kidney problem, do the lungs react right away if there's a kidney problem? Absolutely. Yeah, you guys, I can't even keep up with you guys responding. Jolene, Katie, Lori, Christine, Eric, Steve, yeah, yes. If you have a metabolic problem, the respiratory manifestation is immediate. It starts trying to compensate instantly. You breathe all the time. Boom. Instantly tries to compensate. Instantly tries to take over. Immediately, right away. And that's exactly what you need to be thinking of exactly how you need to interact. So, if you understand the concepts, the idea behind each one of these, just like I drove you through it, we talked about CO2. CO2, respiratory. Go blow off some CO2 if you're mad, bro, and I want you to remember that. And I'm telling you, if you think about that on your test the next time, you're going to come back, you're going to send me some love mail. You're going to say, oh, Kendall, I love you. I thought about how mad I was, bro. It used to be bro, but this is 2000, whatever year it is, 2015. 5 years ago it was bro, and now it's bruh, whatever. But so you're going to think about that, and it's respiratory control. And you think about renal control, it's slow, because those basic girls, they never stop being basic. Once you're basic, you're always basic. I'm sorry. So let's go on. So metabolic acidosis. This is what we were talking about right here. And this is huge. I see so many patients, or students and patients too, but students that get so confused on what we were just going over. So let's just back up a second. Look at these levels. It's an acidotic patient. It's a low CO2 and a low HCO3. They're all going exactly the same one. So low, low, low. Acidosis. Patient has a problem. What kind of problem? Well, let's think about it. These are types of patients in renal failure. These are the patients that their kidneys are not working. Now, this doesn't make any sense to me, you think. Renal failure, if my kidneys make, that's where the mistake is. Your kidneys reabsorb bicarb. Bicarb is basic. Kidneys reabsorb bicarb. If there is one thought that I want you to burn into your head, and I want you to burn it in there, I don't care if you tattoo it on your own, on your arm, on your leg, on your finger, just don't cheat. I don't support cheating. I want you to think respiratory system, blowing off CO2. I want you to think renal system, reabsorbing bicarb, getting rid of acid, right? Reabsorbing bicarb. So I reabsorb bicarb and I excrete acid. So if I don't have any kidneys, my kidneys are gone, they're dead. I can't get rid of acid and I can't reabsorb bicarb. So what happens? I have no bicarb and I have lots of acid. Sounds like a great picture for metabolic acidosis, and that's exactly what happens. I become acidotic because my kidneys are failing, and I end up with lactic acidosis, or if I'm diabetic because my kidneys are dead, diabetic ketoacidosis. That is exactly what I want you to think. You have to understand, think about what actually happens. If all you can remember in this entire scenario is how the systems work, the respiratory system, if I'm breathing, if I breathe fast, if I breathe really fast, I'm blowing off CO2. I'm going to blow off CO2. I'm getting rid of it. I'm going to end up with a low CO2 if I'm breathing fast. If my kidneys are dead, what do my kidneys do? My kidneys increase my bicarb and decrease my acid. So without any kidneys, I'm going to end up with a lot of acids and no bicarb. So I'm going to end up acidotic. Now let me tell you the beauty of why I love Picmonic, and I use Picmonic for med school. I took over USMLE Step 1. Is that actually what we do is we incorporate all this into a Picmonic so you can keep it all straight, and it adds even more ability to keep everything straight in your brain. So metabolic acidosis, this actually ties in all of the signs and symptoms with the Picmonic and what you need to remember. So let's go on to a couple more. I got a couple of hints here for you before we jump into compensation. Let me just check to make sure I got all of these. So many questions come in, I honestly can't even keep up to it. It's just so many. So how do we make sure we keep compensation understood? Now, first, we always follow the same process. If you skip the process, there's a problem. So I'm going to follow pH, I'm going to follow CO2, I'm going to follow bicarb. Now, true compensation, if I need to understand whether there's compensation, true compensation rarely puts anything back into a normal pH range. Now, if you're given an acid-base problem and there is normal pH, immediately the answer has to have compensation in it, or it has to be a mixed alkalosis acidosis. At the nursing level, if you get those kind of questions, that's kind of mean. I'm going to be honest. But at the med school level, that's understood. But at the nursing level, if you get a pH in a normal range, you need it. One of your answer choice has to be compensation included. And we're going to go over compensation right now in just a second. And I want you to remember now, we went over it. Now that I threw this in here, Rome. Respiratory or opposite direction, what? pH and CO2. Metabolic, everything usually goes in an equal direction. In this, oh, hold on, definitely skipped lots of slides here. Let me just get back. Definitely not expecting that. Too many swipes on the keyboard. So, respiratory opposites, metabolic type problems are equal, all in the same direction. So, if I look, right, Ahmed actually said that means it's full compensation. If a patient is back into a normal pH range, we could say, yes, that's full compensation. Full compensation definitely works with lots of a math problem on understanding the logarithmic scale on whether it's actually back in true full compensation, and that's definitely beyond the scope of a normal nursing type question as far as NCLEX goes. Now, if you have one of those evil instructors, trust me, they're out there. Definitely something we can go into at a later time. You can email me and I'll send you some more info. So the basic concept, all values up, metabolic alkalosis. All values down, metabolic acidosis. So let's look at a couple more acid-based type questions. So what's this one? Acidotic or alkalotic? I'm not running through all of the single steps individually. Immediately, so you should be pH. Is it high or low? pH, low. Acidosis, right? Correct. You guys are, I'm impressed. Today's the best interaction ever. So anytime I look at CO2, is it high or low? 35 to 45. Remember the ranges. You can't mess those up. It's above 45, high. So that's down and up. And so those are opposites, right? So what about bicarb, though? 22 to 26. There's definitely something going on there. Is that normal or high? It's high, right? I mean, Kaylee or Nesta, right? That's definitely high, but that doesn't make any sense on based everything we went on. So let's look at the answer. It's respiratory. It's an acidotic problem. pH first. Let's look at the pH. pH 7.24. Boom. Acidosis. Always the choice. Acidosis. You can throw away any alkalotic type problems. But the CO2, high. So those are opposite. Immediately we should think an acidosis type problem. But these very complex questions say, is there compensation or not? Well, let's think about it. If there's acid and there's base, there's CO2 and there's bicarb, does anybody know what the ratio of bicarb to, or sorry, CO2 to bicarb is? I mean, there's a ratio out there. It's definitely a balance. If I have this many apples and this many oranges, how many do I need to bake a cake made of peanuts? I don't know. It doesn't matter. Exactly. Several of you are typing in. Yeah. So if I have CO2, it takes 20. It's a 20 to 1 ratio. 20 to 1 parts. And I mean parts like parts per million type. of 20 parts CO2 to 1 bicarb, because bicarb is very, it's like it's like a juggernaut, right? It's slow to come in, it's slow to compensate, but it's definitely going to just crush everything in the path. But CO2, it's quick, it's whimsical, it comes in at a jiffy, and it takes a lot of parts to make a difference. So let's look at this question, now that we know that. pH, 7.24, acidosis. CO2, high, opposite pH. Definitely respiratory acidosis. But how do I know compensation? The easy way. How do I immediately know it's compensated? Bicarb's out of normal range. It's increased, right? Done. Does that make sense immediately right away? pH, CO2, they're opposites. Respiratory opposites, right? But my bicarb wasn't normal. So what does that mean? I mean, how do I know that there's compensation? Well, there's two ways. Jolene, so let's think about it. If my pH was low, my CO2 was high, so I immediately know it's respiratory compensation. Well, typically on most questions, and I'm being evil here, and I'm just giving you lab values, but I can tell you two things are going to clue you in that there's compensation going on. Number one, the patient didn't just present with this problem. Number two is the fact that in the question, it's going to tell you patient presents with blah, blah, blah problem, and it's been 3 days. It's been a day. And that way you know that the bicarb has been able to increase, been more than 6 to 12 hours or 24 hours to compensate to increase, and then you immediately know that if bicarb is increased, if CO2, bicarb increases to compensate, why would bicarb increase? If I look at this, let's look at all three of them across the line. Why would bicarb increase here? Because what's it trying to do? Bicarb is trying to compensate. What's it trying to compensate for? Acidosis. Exactly right. Valerie, that's 100% correct. The bicarb here is increasing slowly. It's the juggernaut. Boom, 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 boom. It's coming in slowly to compensate after 24 hours for the pH, and it's going to bring it up. pH instantly tells me it's acidosis, but how do I know that there's compensation? Does anybody know? Anybody know? So I've got a high pH, but it's, okay, right. You guys, right, Nick, exactly. I'm just going to skip through here, see what I got. Yeah, lots of you guys are kind of on the exact same same path, rather, price. I don't know where that came from. 7.46. Is 7.46 really that high? 7.45 is normal, right? No. But if I look at this, so 7.46 high, CO2 high. Well, instantly right there, instantly I know this. It's acidosis and it's a metabolic problem. They're not going opposites, right? But let's look at that CO2. 35 to 45. Is it out of normal range? Yes, it is. It's increased because what's happened is it's increased to compensate for that high bicarb level. And that's a very difficult concept. And we're definitely going to record this, and I'll give you guys the opportunity to go back through the beginning and understand those beginning concepts. What we're saying is understand pH, understand respiratory, CO2, understand HCO3 bicarb, renal system. And if you go through and you truly understand those concepts, and it might take you a couple of times, trust me, I have not been, this is not my first rodeo in acid base. I love acid base. You're going to really understand the concept once you get it. And what you're going to see here is that, well, it's also metabolic acidosis if CO2 was normal, or if CO2 was 60, because that's exactly the same up mentality. What you're going to see, though, is that it's almost corrected pH back to a normal range. If pH was 7.45, that's also normal, but that still means the metabolic acidosis only be a fully compensated type scenario. And that's exactly what we're trying to say here is pH, it's near normal. CO2 is high, but it's very close to a normal range, and HCO3 is also high, of course, and that's what's causing the problem. So we've went over lots and lots and lots of stuff. So let's quickly look through this. We want to make sure every time you go through this, you understand the normal lab values, the normal ranges. If you don't know the normal ranges, you're done. You just give up. You're not going to understand acid base unless you know the normal ranges. you're going to understand the concepts for each particular one. You're going to understand CO2 respiratory, HCO3 renal system. You're going to understand that and how the systems regulate each particular one. And what I want you to do is follow the same steps to interpret each one. Look at the pH. Next, always look at the CO2. Next, always look at the bicarb. And you're going to look at the respiratory, and you're going to find out if it's opposites or the same way. You're going to look at bicarb and find out if it's going the same way as pH. And then, of course, lastly, you're going to shower. Oh, shower Kindle with gifts. Oh, who threw that in there? That might have been me. I don't know. Maybe I made this. I'm not sure. But definitely shower with Kindle with gifts is very important. I'm here in the Tempe office at Picmonic. You can send them, care of Kendall Wyatt, and my dog Stitch. We love lots of things, chocolate, candy, money, you name it. Just send lots of gifts. We love gifts, actually. So anyway, no, seriously though, follow the same steps every single time. If you skip a step and you try to look at bicarb first, you're going to mess up every single time. I guarantee it. Absolutely, without a doubt. Hundreds of questions pouring in, so let me just get in here. So, just really quick, just trying to resize my screen. Sorry, guys. So a couple of you guys are actually asking if we're going to be recording this. We record all of our webinars, and definitely something we offer. And we usually, you can find that. Picmonic, one of the great things about Picmonic is that we're Picmonic. I'm a student. I'm a third-year medical student, and I actually came to work for this company because of learning with Picmonic. But we definitely are students for students. So we're not here to, yes, we're a company. Yes, we make money, and that's our goal, but we're students for students. So we provide most of these recordings on our website. You can go on our website or our YouTube channel and find these recordings. It's definitely something we post up within a couple of days. So Jerry, a couple of you actually asked for that recording. I'm just trying to get through so many things. So somebody says, for some reason I can't see your names all of a sudden, so I apologize for this, but someone says, so I have that evil teacher who does ask for full and partial compensation. So how do I tell if it's full versus partial compensation? So a fully compensated patient, how do you really tell? Number one is pH is back in normal range. If pH is back in normal range, full compensation. Boom, got it. And if they're using the Hasselbalch equation, that's definitely beyond the scope of what we're going on today, but it's definitely something that you can use to understand like a deeper understanding of what's going on. But the quick and easy dirty way is if pH is back into a normal range and everything else is off, then is it closer to acidosis or closer to alkalosis? And that means it's alkalosis if it's high with full compensation. And that's the way you definitely should go and to be able to tell. If there's no compensation, then the CO2 or the HCO3 would be in a normal range. And that looks like it's Rhonda that asked that question now that I've got the names popped up. Definitely some questions on some software crazy going on here. Yeah, right, Rhonda, I see you now. So what do you mean? Sure, I don't understand that one. So will HCO3 always be filtered by the glomeruli? Any reason it wouldn't be filtered from the blood, causing it to build up? And that's from Katie. So Katie, another thing in Picmonic, of course, you can see the proximal tubule Picmonic, but bicarb is primarily reabsorbed in the proximal tubule inside of the nephron. And of course, the proximal tubule inside of the nephron does most of the brunt work. We know it does pretty much bulk of the work aside from reabsorbing free water, and that's definitely what's going on. That's definitely where the problem is. You usually don't see any type of other problems in there per se. Let's see here. I'm taking the NCLEX next Thursday, and I have enough time to cover the info for NCLEX Champion. Paula, I'd actually really just, I'd really offer you to just reach out to me personally. Let me just get to the email here, feedback@picmonic.com. Just reach out to us, send us an email, definitely tell it, you saw the webinar, and I can give you some more personal information on exactly really to help you, give you some just teed up information, just really some kind of, it's like, I always say this with everything, it's like cheat codes, you play video games, kind of have cheat codes. I mean, there's no cheating on the NCLEX, and I don't warrant that whatsoever, but there's definitely some things that really can tee you up to give you your best foot forward to really help you out. And we have a full NCLEX study guide that is available as part of Picmonic, available for you, definitely. And just look through. Donita actually asked, do you know when the next ECG webinar is scheduled? And I actually, as much as I would love to admit this, I actually don't know when the next one is. Steve really schedules those for me, and he really tells me what you guys reach out is if I haven't spoke to you to say when the next one is. But we do have a full-on ECG, EKG webinar scheduled again, and one of my passions in educating is definitely teaching ECGs, and I'm an ACLS instructor, and I love it. It's definitely one of my passions aside from acid base. Yeah, Brianna, ECG webinar. Yeah, I know. It's definitely one of my favorites. Thank Candace for the love there. Candace says you need to be my nursing 1 instructor. Sorry, Candace. I just love teaching. So one of the things is there are some of these things I love to go over. So reach out to us, and one thing that's going to come up, it's going to pop up for you when we end the webinar is a survey to tell you kind of what would you like to see next. Reach out to us and let us know. We do these free. I definitely don't. I pick these because I kind of pick my favorite topics, and I know the hardest things to cover, and I really try to make sure that they're the easiest things for you. But definitely reach out to us and let us know what you're thinking about for sure. What you kind of have troubles with and what you want. You guys are sending us some interesting statements, and I appreciate the feedback. Good things, of course, nothing bad. I mean, there was one about my hair being messed up, but that's okay. So, Brianne, sorry I can't do a webinar a day. We'd love that, but I am a third-year medical student, so I do have to go do things as well. So, and that's what we're here for. So, one thing's for sure, I don't have anything else. I just have this question. I don't know if you guys saw this, but it's definitely a question I wanted to go over. We posted it on our Facebook, and I wanted to cover it for you. So, a 26-year-old male patient, it's kind of putting everything together, who was injured in a motorcycle accident, is brought to the intensive care unit, the ICU. He's on a mechanical ventilator. The ABG values at the start of your shift are a pH of 7.24, a PaCO2 of 68, and an HCO3 of 25. What should be the nurse's first priority? So this is kind of putting everything together we just really talked about. So if I saw this question as a nursing student, what I want you to do first is I want to really just look at those ABG values. I want to understand, is it alkalosis or acidosis? Boom, pH, got it, acidosis, right? And you guys are typing in the answer as faster than I could possibly think, and that's great. So, boom, acidosis. I want to look at the next step, always. I don't care what order they give it to you. Go to the next one, PaCO2. Is it high or low? CO2, CO2 is high. Those are opposites, right? R-O-M-E, Rome. Opposites. What should I be thinking? Boom, this is a respiratory problem. What is going on? Before you even read the answers. PaCO 68, then, okay. HCO3, high, low, normal, normal, boom. So what does this tell me? The patient is in what? The patient is in acidosis with a respiratory origin, respiratory acidosis. Now, because of everything we just went over, everything we just covered, what do we know immediately? What should you be thinking? Patients in respiratory acidosis. Well, if a patient is in respiratory acidosis, what's one of the causes of respiratory acidosis? We covered it, right? Respiratory acidosis? Anybody? Patient's on a mechanical ventilator. The patient is not getting effective respiration. The patient either has a low tidal volume, the patient either is not breathing at an adequate rate. Now, it doesn't matter what type of answers I gave you, the immediate thing you should be thinking is that the patient is not breathing adequately. The rate or depth is not adequate enough, needs to be increased. That patient's mad, bro, and he needs to go out and he needs to blow off some CO2, right? He needs to get out. He needs to blow off some CO2. He's got to get rid of it. And that's exactly what you should be thinking when you read these types of questions. It doesn't matter what the first two sentences say. You should be able to, boom, those first two sentences should be able to let you think and verify what you're thinking to know that you got the right answer. You got it, and you got it right. And the answer here, of course, is 3. Increase the respiratory rate or depth. This patient is not oxygenating well enough. Somebody messed up those settings on the mechanical ventilator, and that's maybe what you'd be thinking. Now, you're not a respiratory therapist. Maybe you don't need to be thinking those. That's correct. But the problem is this patient definitely is not ventilating adequately. And remember the ABCs, A, airway, every single time. It doesn't matter, no matter what, airway. That's what you should be thinking every single time. Now, I put this in here as a distractor for you, and that's putting naloxone or Narcan, thinking about preparing that for administration. Now, that's only an adequate answer in what kind of scenario? A couple of you already said it, overdose. But this patient had a motorcycle accident, and he's on a mechanical vent. If this patient presented with the ER and he's breathing at a rate of 6 times per minute because he overdosed on a bunch of medicine maybe, that's when you'd be thinking about that kind of naloxone or Narcan type. Yeah, heroin, right? That's what you guys should be thinking. That's when you think opioid overdose. But that's not this type of scenario. And or even intoxication. But the very first thing you need to think of is, boom, the problem is the patient is not adequately oxygenating. That's what you need to think about. And that's what's going to always drive you is the concepts of thinking conceptually about what's actually going wrong with the patient. And then that's going to drive you to the right answers because you're always going to follow ABCs. Airway is always first. And what else? What also starts with A that would have always been the right answer in any scenario here is any type of assessment. Assessing your patient would have overruled any of these interventions. And that's right, Jeleni. That's absolutely right. Actually, a lot of you typed that in, assessing. If there was an assessment answer in here, that would have been first, no matter what. Always assess your patient. So I always seemed like I always go over about 10 minutes on these. So I apologize for going over. I hope you learned a lot. If you have any questions or you need anything else, we got that feedback and the handout in there for you. I'm going to go over that. I think a couple of people had questions on there, and I'm going to review those. But you can reach out to us at feedback@picmonic.com. And always, just email us if you have any questions. You have my information. My name is Kendall. Sorry, Kat. My name is Kendall. Or you can just, hey, that crazy webinar guy that I saw today. There's not really that many of us here at Picmonic. You could reach out to us, feedback@picmonic.com. Go to Picmonic. Try it out. In that handout, there's a after you understand these concepts conceptually, and I hope that you guys as nursing instructors are teaching you these concepts of understanding what's going on inside of these disease processes, that you can go and you can apply these great memorization techniques of what Picmonic actually allows. That's all I have for today. Reach out to us if you have any questions, and that's what we're here for. We're students helping students. That's what I'm here for. If you have any other questions, you can reach out to us. As always, just definitely send us an email. You can send it out to me. I'll definitely get to it. I apologize in advance. There's usually after one of these is a couple of 50, 60, 70, 100 emails, so it does take me a day or two, but I'll get back to you and let me know if you have any questions. As always, I appreciate you guys attending, and good luck learning. I hope you learned something. Have a great night.